Have you ever wondered how a mere second could alter the course of a life? A stroke, a sudden interruption in the brain's blood supply, can happen in just that, a fleeting second. And in that moment, everything changes. Strokes, while undeniably severe, can oftentimes be prevented or mitigated. But to do so, one must first understand the signs. The symptoms of a stroke are distinct, yet can be easily overlooked. A sudden numbness or weakness in the face, arm, or leg, especially on one side of the body, is a common symptom. This numbness might be accompanied by confusion, trouble speaking, or understanding speech. Imagine being in the middle of a conversation and suddenly, words don't make sense anymore. Another sign to watch out for is trouble seeing in one or both eyes. This could manifest as blurred or blackened vision, or even double vision. Think about looking at a familiar face, but it's hazy, distorted, or perhaps there are two of them. Difficulty walking, dizziness, loss of balance or coordination are also telltale signs. It's as if the ground beneath you shifts, making it hard to stand, let alone walk. And then there is the severe headache, often described as the worst headache of one's life. It comes out of nowhere, with no known cause. It's a pain that's hard to ignore. Now you might wonder, how can I remember all these signs? The answer lies in the acronym F.A.S.T, where F stands for face, A for arms, S for speech, and T for time. If the face droops on one side or there is a lopsided smile, that's a sign. If one arm drifts downwards when both are raised or there's numbness, that's a sign too. Slurred speech or difficulty speaking is another clear sign. And time is of the essence. If you see any of these signs, it's time to call emergency services immediately. Recognizing the signs of a stroke can make the difference between life and death, or between a full recovery and lasting disability. It's not about instilling fear, but about raising awareness. Because when it comes to a stroke, every second counts. And in those critical moments, understanding the signs could be the key to saving a life. Remember, a stroke doesn't just happen, it announces itself. And it's our job to listen.